There have been case reports of people developing skin cancers on their fingers who were, acrylic nail users who are getting cured with UV light. And I think, we know it's like a tanning bed for your fingers, so it can cause DNA damage. The sense I get from, the literature is like, yeah, it does probably elevate your risk, but how often you have to go to really see an increase if you have no other risk factors, we don't really know. But I think it's a great point that we should be careful.
Hi, skin friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I am really excited to have my colleague, board certified dermatologist, Dr. Carina Woodruff, joining me today to talk all about nails. Now, it seems like nails are totally the it thing to do right now. Even my 9-year-old told me she wanted to get tips on her nails and she loves getting those like press on ones. And I get it. I remember being about her age with Lee press on nails. And I still every now and then will treat myself to a manicure or pedicure at the nail salon. But did you know that there are actually some things you could be doing at the nail salon that could be hurting your nails and maybe even causing an infection? Dr. Woodruff is going to be walking us through how to make sure you can keep your nails not only beautiful, but healthy at the nail salon. She practices dermatology at Epiphany Dermatology in Dallas, Texas, and she is passionate especially about allergic contact dermatitis, which are those itchy rashes that people get when they come into contact with things like fragrances or preservatives or adhesives. And she specializes in patch testing. And she is also one of the co-founders of Vetted Derm Lab, which is a skincare company that makes truly hypoallergenic skincare products that still feel elegant and luxurious. If you love getting your nails done, you are definitely going to want to stick around for this episode. Dr. Woodruff, thank you so much for being here. I'm so excited to talk about nails and why someone might be itchy. So thank you so much for being here.
Thank you for having me, Dr. Mina. Very excited to be here too.
I introduced you briefly in the beginning, but I would love for you to just tell the audience in your own words who you are and what you do.
So I'm a dermatologist. I'm also a mom. I currently practice in Dallas, and my passion is contact dermatitis. I do general dermatology, a little surgical dermatology, but I really like to do patch testing. And a lot of my research and kind of outside work revolves around that.
So what is patch testing?
So patch testing is a technique to identify if there are outside triggers causing eczematous reactions. So, we're looking at things that are coming into contact with your skin, like fragrances, metals, surfactants, etc. And in many cases, what's really exciting is if we are able to pinpoint the source of your reactions simply by taking away those things from contact with your skin, your rashes clear up.
But yeah, you got to figure out what's causing it, right? And with so many ingredients in things, sometimes you don't even know. It can be really tricky. So yeah, patch testing is super key for that. Well, let's talk about something that I feel like nails have just taken off. Like I just had a lady today who looked like she had a piece of artwork on each finger. So very elaborate nails. And I feel like people love going to get manis and pedis and all that stuff. But could that be a potential cause for an allergic reaction?
That's one of the things that I see all the time in my clinic that people aren't aware of because they can present in very sneaky ways. So sometimes it's obvious, you go and you get your nails done and right away you get super itchy, you get a rash around your nail plate, like in the skin around the nail. And then people know, but a lot of times these reactions to chemicals in nail lacquers or in acrylic nails, dip nails, etc., they actually present outside of the hands. And so they'll start in areas where the skin's really thin and the allergens penetrate readily, like around the eyes or the neck area or somewhere on the face. And because it can be something that you've been using for a while without a problem, and then suddenly you become sensitized or allergic to it, it can be really tricky for people to put it together that it's actually the chemicals and their nail treatments that are causing these reactions.
I'm so glad you brought that up because I remember in residency learning like the common cause of an eyelid rash or dermatitis is from nails. So if you're itchy around your eyes, like look at your nails because the skin on our nails is pretty thick, right? But the skin on our eyelids is really delicate. So yeah, you're exactly right. And people frequently don't put that together, like why would you, right? But that is a really common cause. So I'm glad you brought that up. Is there anything in particular with the nails that's causing the rash? Like, is it mostly the nail polish? Is it the instruments people are using? Like, what's the common cause, or is there one?
Yeah, for sure. So we used to see that most of the reactions used to be to a chemical called toluene formaldehyde resin, which is actually a chemical in regular nail polish. But over the last few years, we've seen the rising popularity of things like gel nails or dip nails, acrylic nails, all these different nail cosmetics that last a really long time. So they're super convenient. And we are now seeing more reactions to the glue chemicals that are used in these cosmetic practices. So things like the methacrylates or cyanoacrylates. And I see it all the time. I actually saw a few in my clinic today.
So that's more for like the gels or the dips, you said, right? Not just regular nail polish. Is there a way to safely get those procedures done if you want them, or if you're getting a reaction, you really just have to avoid them?
It's really tough because I, as a girl and someone that like definitely likes to do self-care and I like getting dressed up, I understand that nails are something that brings people a lot of joy. It's a form of self-expression. So I think it's hard to just say don't ever do them, but I think that it's really important that when you do decide to do this, to be aware of the risks. And I find that most of the patients in my clinic, they're getting exposed to acrylates all the time and they have no idea of the risk of sensitization. So whether it's in the nails that you're doing or the eyelash glues, that's another common source of acrylates. The more you get exposed to them, the more likely you are to become sensitized, right? Which is where your immune system starts to recognize that chemical and react to them. And so one thing that you can do is try to limit exposure. So do it for special occasions, but maybe you don't want to have fake lashes, fake nails year round. So give yourself some breaks. I think making sure that you go somewhere where they know what they're doing is also really important because we know that when people try to apply these at home, we're just not as good, right, at applying these things ourselves. And so you're going to have more contact with these chemicals on your skin before they dry, which is actually the time when you're at risk of becoming allergic to them. And so going somewhere to a salon and having it done for you is another thing that can be helpful instead of trying to do it yourself. I think in general, also these things, we're talking about allergy here, but these procedures also can really irritate the skin. They can damage the nails, sometimes causing long lasting damage. And I think when you're getting a manicure, there's lots of things like I see a lot of trends on TikTok, like the Russian manicure, where they're really aggressively removing the cuticle.
I have a hard time watching those videos. I mean, that really hurts me. And I remove nails pretty regularly in my office, but there's something about watching that. It's horrifying.
So horrifying, I think, right? Because you're thinking the cuticles are meant to be there to protect your skin and your nail from pathogens. And so when you remove all the cuticle, that's just a little portal there for fungus, for bacteria. I mean, it looks really beautiful, but it's just not safe. So I think trying to make sure that you're not getting exposed to these things too much. And then when you do get them done, making sure that they're practicing gentle skincare around the area, or what I like to call gentle nail care. So, let's not remove the cuticle. Maybe don't have them file your nail plate, which is, going to increase the risk that the nail breaks. Applying a lot of moisturizer around the area so that you don't have breaks in the skin, which increase the risk of you becoming sensitized to the chemical. All those things can decrease the risk. But for sure, it can happen, and it's something we probably should limit access to.
Gosh, a lot of things I want to break down with all of that. And I'm glad you brought up the point about sensitization because this is something I see a lot with my patients, my friends. People think, but I've been using this forever. This couldn't be what's causing my rash. I've used this product forever. And I had an eyebrow pencil that I used for years. And then all of a sudden, my eyebrows are getting red and itchy. And even as a dermatologist, I was like, no, it can't be that. It can't be that. But of course it was. I think that's important for the audience to know that a lot of times we think, oh, it's the first time you do it. That's when you get this reaction, but it's actually not. It's being exposed to it more and more often. That's what's going to increase your risk of getting a rash. So I think that's a great point for people to know that just because you've done it all the time doesn't mean it's not the one causing the rash. In fact, it might especially be the culprit. With a lot of these, like, nails, it's like a commitment. This is why I do not do my nails. Like, I just can't sit there and I can't have one more commitment in my life. But I find that, yeah, people are just they'll go every 2 weeks and get their nails done. And for them, yeah, it's like expression, but maybe taking a break from that. Like for me in the winter time, I really don't get pedicures and I just do it myself, which you're absolutely right. When you do it yourself, it never is quite the same. But I'm just trying to give my toes a little bit of a break from the gel because I do like gel. So I think that's also a great point. You touched on it briefly about eyelash glue. So, I mean, I can only imagine how painful a rash on your eyelids to the acrylate from eyelash glue would be. Is that pretty common?
Yeah, for sure. And that can be both because of irritation or sometimes people actually become allergic to the chemical. Yeah, it's something that, again, we're seeing more and more of because these chemicals, the acrylates, they're everywhere. And I think one point, Dr. Mina, that I really want to mention that always shocks my patients who come into the clinic and they find out, oh no, it was the nails all along causing that rash on my face or the neck area. The same chemicals are used in a lot of really essential things that we get exposed to regularly. For example, menstrual pads or the diabetic sensors that we use for glucose monitoring in orthopedic implants or dental implants. And so this can become a real problem for people because here you are doing your nails, you're not thinking at all that these things are related. You become allergic, and now if you have to have a surgery or a medical procedure, this might become a problem because you might start reacting to the acrylates inside the cement. And there's definitely been reports of this. So I think that's like one of the things for me that is the most shocking is how widespread these practices are and how little people are aware because they're not informed of these risks. Nobody talks about this at the nail salon.
Absolutely not. You're reading your Us Weekly and watching Home Improvement show, right? That's a great point. I mean, even my daughter is 9, and the other day, in all seriousness, she asked me, "Can I go get tip on my nails?" I was like, "No, absolutely not," for so many reasons. Can you imagine just starting to sensitize her at 9 and, who knows at 35, like, where she's gonna be. But yeah, when you're getting your nails done, it's all fun and everything, but there could be some downstream effects. Like if you can't get that knee replacement or hip replacement or that medical treatment you really need because of an allergy, that could be a big problem.
Yeah, it can be pretty devastating. I'm not surprised about your daughter saying that. I recently saw a kit in this major retailer that I'm not going to mention. They just had a whole shelf of little nail tips and little acrylic kits for kids. They were specifically marketed towards kids, which is just crazy to me because there's no way that they're going to be able to have the manual dexterity to like accurately apply the acrylate. And I mean, it's just nuts. So yeah, we really need to increase awareness about this, so I'm so glad you are highlighting this on your show.
Yeah, for sure. I've seen my children paint my nails, and I can confirm about the manual dexterity. We also talked about just kind of like nail practices, right? Like the cuticles not being so aggressive with removing them. I know sometimes they really dig out the size of your nails. Like, even if it's not really an ingrown nail, they like to really dig that out. In fact, right before my daughter was born, I had a pedicure and I got what's called a paronychia, where I had a lot of inflammation around the end of my nail. And I remember that being more painful than my C-section. I mean, it was incredibly tender. And that's why I'm kind of like laying off the nails for a little bit. But yeah, like they were trying to really pull out my nail and then it caused inflammation and drainage and pain. And it really was not fun. So yeah, just making sure you aren't doing things like that. Great point about overly buffing the nails. It seems like really great and nice and smooth at first, but if you do that all the time, you really are damaging your nail plate.
I love doing girly things, so I'll admit that. Well, before I was a dermatologist, I used to get gels, I used to always get my nails done. And then when I learned about all this, I just think back in horror, like when I was in residency, like, oh my gosh, my cuticles, what have they been doing for years? All these things. It's just too aggressive what's happening. And I think you really have to like advocate for yourself. I'm not saying don't get a manicure, pedicure, but I think you have to kind of give some guidance. It's just really not gentle nail care and puts you at risk of infection and nail dystrophy, nail damage.
I feel like every couple of years, I'll hear on the local news about someone getting a terrible infection at the nail salon. What's that about?
Well, the most common thing is obviously going to be fungal infections. I feel like that's something that comes up a lot in my practice because everyone says, well, I only go to a salon where they sterilize the equipment. So I know for sure I didn't get it in the salon. There's some interesting data that other things in the salon, for example, the nail polish, and in particular the top coat, can harbor fungus and enough to then spread it to somebody else. And so there's just so many potential little sources, even like the tub where they wash your feet could act as a fomite and have fungus there if it's not being covered with plastic. And then, as you mentioned, like sometimes it's just they create a break in the skin by taking out too much cuticle or sometimes like using a sharp device here, like under the nail plate. And then you get bacteria entering, right? And so, again, going back to like being super clean and not like removing those protective things that exist on our skin or nails to prevent infection.
I remember back, maybe it's showing my age, but at the nail salon where they wouldn't use the plastic. I don't know. Do you remember that? Or maybe I'm older than you, but so I am like at least relieved to see the plastic there now and seeing the little pouches, like the instruments have been autoclaved and cleaned, right? Like that always makes me feel better seeing those packages too. So I would say go to a salon where you see that kind of cleanliness and hygiene being used, right?
Exactly. Those two. And then I'm paranoid. So I bring my own top coat and I try to bring my own polish, which is a nice thing, anyways, because then you can top up and repair at home if it gets chipped. But in particular, the top coat has been shown to potentially harbor fungus. And so I think it's a good little practice to bring your own if you really want to be safe.
Do you bring your own instruments?
I don't. No. I think the autoclaving, I think that works. I think I trust them out.
I guess I never thought about the nail polish. I guess I thought it smelled so strong, like nothing could possibly live in there. But that's interesting that the top coat could harbor fungus.
What I had read is that the nail polish itself, because it has often so many biocides, formaldehyde, etc., it's pretty hard for fungus to grow. But the top coat is typically more oil-based, and so they don't use as many biocides, and then that is more of it's a better vehicle for fungus. So they've done some studies where, they inoculated it with fungus, and then they were able to show that it was still growing fungus weeks later. And so presumably, if they used it on somebody with fungus, they could spread. So after I saw that, because, you think about it all the time, I see, toenail infections, toenail fungus every single week.
Every hour.
Every hour, right? And it's so hard because once it's there, our medications are not great. Even oral is not a great, side effects, doesn't always treat it. So I don't know, I feel like it's a question that comes up a lot. Like, how is it happening? Because they're autoclaving stuff. And so I think that might be one potential source, but obviously our environment too.
And that's a great idea to think about. Just bring your own polish. You like the color. You can touch it up at home. And that's really pretty simple and easy. I just chip my nails. So it's like if I get it done, it's like clear anyways. But I guess I should bring my own top coat.
It's hard. I think especially we wash our hands like so many times a day. So yeah, I have no polish right now. I can't. It doesn't last very long for me, especially now that I don't do gels because of the risk.
That is the nice thing about gels, that they do last a long time. But then sometimes I feel like it's on too long and I can't get it off. And I worry about, the damage to my nail plate, pulling it off too. So again, I think use maybe not all the time, special occasions as a special treat. I think that's probably the best way to approach it.
I agree. Yeah.
Speaking of gels, right? The light used to harden the gel, is that safe?
Yeah, that's such a great question. I mean, there have been a few studies. There have been case reports of people developing skin cancers on their fingers who were, acrylic nail users who were getting cured with UV light. And I think, we know it's like a tanning bed for your fingers, so it can cause DNA damage. The sense I get from, the literature is like, it does probably elevate your risk, but how often you have to go to really see an increase if you have no other risk factors, we don't really know. But I think it's a great point that we should be careful. And there's little gloves you can use, or just put like what my salon does, which I think is really nice, is I see them putting like a little moisturizer with sunscreen on at the end when they do the massage before they apply, or you can do that yourself, as a way to protect your fingers. So it's easy thing to do that would prevent you from developing skin cancers there until we know more.
That's a great idea because they usually have your hand, even if you put sunscreen on before you go get your manicure, then you're putting your hands in the bowl of water and that can wash it off. And then they're rubbing lotion on. So I think adding that sunscreen at the end, see what kind of light they're using. I know some places use LED light and they're not using a UV lamp. And then the other thing that I think about that might be more of an issue than actually developing skin cancers is just like causing aging of the hands, right? If you're doing it enough. But I also think about how you drive in a car and that top of your hands are exposed to all that sunlight through the window. You're probably spending significantly more time doing that than the time you would be spending drying your nails every couple of months, every couple of weeks.
Such a great point. Yeah. I love those little like gloves that you can get to drive. My family thinks it's hilarious and they make fun of me, but I swear by them. And when you have seen enough people develop, actinic purpura on their hands, those little bruises, right, from minor damage because of all those age-related and sun-related changes, I think it's a nice little thing to do.
I get some flack from even my office, and we're a Mohs surgery practice, but I just don't care. I truly can see my hands look older than my face because I am better at sun protecting on my face than my hands. So now I wear those gloves too, and I love them. And if I'm driving, I've got them on for sure. So yeah, don't wait until you're already seeing the changes to start using them. They're a great addition even before.
Agree.
So give us sort of your top 3 pearls for someone who does want to have nice looking nails, but they also want to be safe. What are just kind of like your top 3 takeaways for that?
Well, I would say to when you go in, choose a salon that has good practices, like we talked about. So, making sure that they're sterilizing their equipment, they're covering the tub, bringing your own polish with you. So, limiting infections and limiting irritation by those safe practices. I would recommend avoiding doing the acrylic nails too often. So, making sure that you take breaks and kind of save it for special occasions. And then I think the last thing I would say for healthy nails is like make sure that when you go see your dermatologist, you don't have polish on. That's something that I always like people will say, "Oh, there's something going on with my nails, but I just got gel done." And I'm like, "I can't help you. I don't there's so many things. Nail disease is so complex. There's so many different causes and you can get skin cancer, you can get inflammation, you can get infection. And I think that we have such an important role in diagnosing nail disease, treating it. Sometimes it's a sign of like internal problems, right? So I think a big part of nail health is taking breaks and letting your dermatologist actually take a look at your nails so they can give specific guidance to you because it's not all nail fungus or it's not all the same things.
I'm so glad you brought that up because that is huge, right? People come in with nail polish and tips and we can't assess their nails. And especially if you have a concern, right? We really, really, really have to see it. So that's a great point. And I saw a gentleman today for a melanoma on the bottom of his foot. And I would also just tell people when you're seeing your dermatologist for a skin check, make sure that you're taking your shoes and socks off, right? So that they can actually look at your feet, look at your toes, look at the bottoms of your feet, the soles of your feet. And so making sure that there's nothing there as well is really important. I think sometimes that area gets forgotten.
That's such an important point. All the time, I feel like I'm having to convince people to get full body skin checks. A lot of times people come in and they're like, well, I have this spot or that spot. And I'm like, just let me look because you can't check your back. You can't check the bottom of your feet, your scalp, right? And we find skin cancers all the time. I mean, I had a patient who came in with a cyst and I found a melanoma. So there's such value in just letting us look everywhere because like you We're mentioning skin cancers can happen anywhere, not necessarily where you get sun.
That's a great point. Yeah, sometimes people are like, "No, no, I'm good. Nothing on my legs." Nothing. I'm like, "Really? Have you looked at the back of your legs?" So, yeah, and a lot of times people come in for something unrelated. So, yeah, if your dermatologist can check you over, definitely jump at that opportunity because I know there are areas on me. There's no way I can see or tell or check. So, that's a great point. And then when you're getting your nails done too, especially if you tend to wear polish on your toes, actually look at your nails before they put the polish on and make sure there's nothing going on there, a dark streak or a new spot or something under the nail. So that's also a great time if I have a patient who does have paint on their nails or gels or whatever, I'll say, well, have you noticed any changes? So just be aware to kind of look down when you're at the salon and just make sure things look okay.
Yeah, absolutely.
Well, this has been a lot of fun. I have learned a lot myself, and I'm glad to know some tips for when I go to the nail salon that I have not been doing. So, this has been great, great pearls for me as well. But, Dr. Woodruff, can you just share with the audience a little bit more about where they can find you or follow you? I know you also have a really cool skincare company that I'd love for you to share with the audience.
Yeah, thank you. So I practice in Dallas right now at Epiphany Dermatology, and we're in the Baylor kind of location downtown. I am on Instagram. I'm also on TikTok, but I'm mostly active on Instagram. I share a lot of kind of information about contact dermatitis, but also about just skincare in general, skin cancer, inflammatory conditions, motivated by this experience of seeing patients all the time, having reactions. And actually, I am also someone that suffers from contact dermatitis. I'm allergic to fragrances. And that experience, I think Lindy, who was on, had the same experience actually. The experience of being a patient and not having options, being very limited in what I could use, motivated me, along with Lindy and Mina, to create our own skincare line, something that was truly hypoallergenic, met a standard of hypoallergenic as defined by dermatologists and people who do this kind of allergy testing. So our brand is called Vetted Derm Lab. We are available online. We're available in some dermatologist offices. It's really exciting. We launched a little over a year ago and it's going great.
I love your glass bottles. I think that is so cool. They're so pretty.
Thank you. Yeah, we wanted, because part of the experience when you have these allergies is you get told you have to use these products that feel very medicinal. The packaging isn't nice. A lot of times they don't have the really exciting actives like anti-aging ingredients. So we wanted to create something that felt like luxurious and like you were doing more than just moisturizing. You were actually improving your skin health, doing some anti-aging, repairing the barrier, and something that looks really pretty. The glass piece is also, we wanted to do something that was environmentally friendly, more sustainable. It worked out nicely.
Yeah, well, I think that's fun. They look really pretty. So it's great to have products that truly do not have fragrances, that are safe for your skin, and you can still feel like you're enjoying some luxury with your products if that's something, that you enjoy. So very cool. I will share all of that in the show notes. And thank you so much for being here. And we'll see everyone next week.